Assalamu alaikum everyone. I hope you're all doing well. My name is Salah Hafiz. I'm a second year medical student, and today, inshallah, I'm going to be giving you guys this crash course, okay? Now, in this crash course, I'll be covering everything that you guys took in your community medicine course this year, with emphasis on the high yield concepts, right? The concepts that are commonly asked about. طيب. If you guys have any questions, you can always email me, or you can send me a message on my WhatsApp. My number and my email are on the screen. One last thing, after you guys watch this crash course, I want you to go ahead and solve as many past paper questions as you possibly can. Yani solve until you can't solve anymore. Because one thing about is that the concepts are very commonly repeated. Yani the concepts that are tested are very repeated. I wouldn't say the questions themselves are repeated as much, but the concepts are. So if you can do well in past, inshallah you can do very well in the actual exam as well. طيب, Bismillah, let's start. So the first lecture we're going to discuss is maternal and child health. Now I know that this isn't the first lecture in your actual syllabus, but my slides are organized a bit differently, okay? We'll get to them later. طيب, maternal and child health. What is maternal and child health? Simply, it is the health services that are provided to women and children, okay? So we have women and children in the population. All of the health services that we give those women and children is called maternal and child health. Now, maternal and child health isn't the same as MCH indicators. MCH indicators measure the social, economic, and educational status of women, okay? As well as the community level access to primary care. It basically measures how good or how well the maternal and child health is in a certain country or a certain place. طيب. Now, the specific factors that they measure, you guys need to know, okay? Because they could be asked in an MCQ. Now, there is a large disparity or difference in the maternal and child health indicators, MCH indicators, between the high income countries and the low income countries. طيب. And this is because high income countries simply have more resources, for they're able to they're able to give better healthcare to their women and their children. طيب. Now, maternal health is the health of the woman during pregnancy and postpartum, yani her health while she's pregnant and after she gives birth is maternal health. Maternal morbidity is any situation or any health condition that is attributed to, yani related to, or aggravated by, made worse by the pregnancy. And it could be a new condition that the pregnancy caused, or it could be an old condition that the pregnancy made worse. Or it could be both. All of those are maternal morbidity. And women's health is the branch of medicine that focuses on the treatment and diagnosis of diseases that affect a woman's physical and emotional well-being. طيب. Now, I've never seen this being asked about before, but I just included it there for the sake of completion. Now, maternal mortality. What is it? It is the death of the woman while she's pregnant, tamam, or within 42 days of the termination of pregnancy. Now, this could be from any cause that is related to the pregnancy or aggravated by the pregnancy. This is extremely important, especially this 42-day thing, okay? So if a woman dies while she's pregnant or within the 42-day period after she gives birth, that's called maternal mortality. طيب. Now, this maternal mortality or maternal death can be direct or indirect. If it is direct, that means that it is caused directly by the pregnancy. Yani she gets pregnant, tamam, a certain complication happens due to that pregnancy, and she died. Okay? Indirect maternal death is there's a previously existing health condition, طيب, and the woman gets pregnant. Okay? And that pregnancy makes that health condition worse, for therefore she dies. Okay? We had a question about this, and a woman had a problem in her heart valves. Okay? She had a problem in her heart valves, and then she got pregnant, and then she died. طيب. Is that direct or indirect? The answer was indirect. Why? Because the pregnancy made the problem worse, and therefore this caused her death. طيب. She wasn't healthy before. If she was healthy before, okay, and she got pregnant and she died, that's direct. Okay. Now, maternal mortality is maternal death divided by live birth times 100,000. Basically, what we're trying to find is out of every 100,000 babies that are born, how many mothers die? طيب. And the way we do this is basically doing maternal death, يعني the amount of women that die, divided by live birth, all of the babies that are born, times 100,000. Okay? This formula is extremely important. You won't be asked to calculate anything from it. You just need to know. Now, the top three causes of maternal mortality are hemorrhage, hypertension, and indirect causes. Hemorrhage is basically bleeding. طيب. Hypertension is high blood pressure. And then indirect causes could be anything. طيب. Anything that's indirect that we mentioned. Okay? We mentioned the difference between direct and indirect causes. Indirect causes is the third most common. Hemorrhage and hypertension are both direct causes. The most important thing in this slide is hemorrhage. طيب. Hemorrhage is the top cause of maternal mortality. Now, 99% of maternal mortality cases happen in underdeveloped countries. What does this tell us? It tells us that maternal mortality is preventable. It can be prevented, طيب? Because developed countries are doing something to prevent maternal mortality. Now, there's many barriers, to access maternal health care. طيب? يعني if a woman wants to access maternal health care, there are many barriers. Okay? And these barriers, all of them, they're more common in low income countries compared to high income countries. Okay? And these barriers include distance. Okay, the distance to the healthcare services could be, and the healthcare services could be far. Transportation, طيب. Awareness, availability of services, attitude towards healthcare professionals. But the most important one is poverty. Poverty is the number one cause or the number one barrier to access maternal healthcare. طيب. Again, all of these are more common in low income countries or developing countries compared to developed countries. Now, if you get a question like this in the exam, actually, I want you guys to pause the video and try to answer it. طيب, if you get a question like this on the exam, the way that you're supposed to answer it is when they ask who has the most significant determinants of health. Basically, you read every case, طيب, and you try to see who has it worse, simply. And you read every case individually, and you try to think about it, and you see who has it worse. طيب. Now, here, the answer is A, okay? Because she lives 2 hours away and she dropped out of high school, right? So these are two determinants or two big determinants. And she lives 2 hours away, so she's far, and she dropped out of high school, so that's an educational barrier right there. طيب. The rest of them, they're doing pretty good. This is a graphic designer, طيب. So she has a stable income. This one's husband has good income. This one works as a school teacher. Nothing much really. يعني no distance is mentioned هنا. But this one lives 2 hours away from the closest clinic and she dropped out of high school. So A has the most significant determinants of health. Usually it's going to be clear in which one has the most significant determinants of health. Yeah, and one of them is going to clearly stand out. Okay? Antenatal care is basically primary maternal health care. Yani it's the basic maternal health care given to the pregnant woman. And this ensures two things: her safety and the safety of the fetus, or her health and the health of the fetus. Now, this is given to all pregnant women. طيب. What are some examples? Early and continuous risk assessment, okay? Fetal growth assessment, we're trying to see if the fetus is growing properly. Mental health evaluation, okay? Trying to see if the mental health of the mother is good, يعني. Medical intervention is needed, okay? Now, what if the condition gets worse? What if it worsens? This is where secondary care comes in. طيب. If the condition gets worse, this is where secondary care comes in. يعني secondary maternal care offers specialized care for managing pregnancy complications. What do we mean? مثلا maternal morbidity basically. يعني if a woman got sick while she's pregnant, okay? Or there was any type of complication related to the pregnancy. طيب. These cases are referred from primary care to secondary care, okay? And they're taken care of in secondary care. Now let's apply that. Which one of the following requires a primary healthcare service? The correct answer in this case is D. طيب. A 27-year-old pregnant woman with no history of complications. طيب. She has no history of complications. So therefore, she requires primary care, not secondary care. These three women right here, all of them, they require secondary care. Because this one's diagnosed with sickle cell anemia at 5. This one finally got, this one recently beat cancer. This one finally got pregnant after 5 years. So they all have something going on that would require secondary care. But D, she only requires primary health care. طيب. No secondary care. طيب. What are some things that are needed in the diet of a pregnant woman? First, we have folic acid. Okay? Folic acid is needed in the diet of a pregnant woman. Okay? Vitamin D to prevent osteoporosis. Important as well. We need vitamin D. We need to give the woman vitamin D to prevent osteoporosis. What's osteoporosis? Osteoporosis is low bone density. The woman needs vitamin D so that she can avoid getting low bone density. Finally, daily iron supplements. These are given after the first 3 months. Okay? So after the first 3 months, we give the woman daily iron supplements. Okay? Now, this condition right here is called spina bifida, okay? And this condition occurs because the mom doesn't consume enough folate. طيب. We said that folate is needed during pregnancy. Now we know why. We know if the mother doesn't consume enough folate, the baby will be born with this big bump on their back. And this condition is known as spina bifida, okay? Salah, this is the only thing I remember from COM before I actually had to study for this crash course. This is the only thing I remember from it because this picture is just so unique. I don't know. But yeah, and it happens because of the incomplete closing of the back brain membranes around the spinal cord. I don't know if this one's important, but know it anyways. But the main thing, it happens because there's a lack of folic acid in the mother's diet, okay? طيب. Now, what is needed only in a few cases? We discussed vitamin D, we discussed vitamin D, طيب, iron supplements after the first 3 months. We also said folate are needed always. But now what is needed in a few cases? Calcium and multivitamins, okay? Calcium and multivitamins are needed only in a few cases. طيب, now what should be avoided? Vitamin A generally should be avoided, except in areas where vitamin A deficiency is a problem. يعني if the mother lives in an area where vitamin A deficiency is a problem, she can take vitamin A. طيب, but why is vitamin A avoided generally? Because it can cause night blindness in the baby. Okay. Now, caffeine intake should also be restricted to 300 milligrams in the first 3 months. Just memorize this. 3. Okay, 300 milligrams in the first 3 months. طيب, now what are the things that we assess in a pregnant woman? Maternal assessment. First, we look at her family history, طيب, and her past medical and surgical history. This is basically where we ask her questions about her health, and that's pretty much all you need to know. Tobacco use. Tobacco use can decrease the gestational size of the baby. What does that mean? That means that the baby is born at a smaller size than what they're supposed to be born at. طيب. And for this, we offer smoking cessation to prevent the mother from smoking. Because if she smokes, then her baby is going to be born at a smaller size than what he's supposed to be born at, or she's supposed to be born at. Now, this is very important, right? The gestational size of the baby is decreased when the mother uses tobacco. Finally, we look at alcohol and drug abuse as well as domestic abuse. Alcohol and drug use as well as domestic abuse. طيب, what are the things that we need to assess in a fetus now? First, we need to assess movements. We need to assess heartbeat as well. And this device right here is used to assess heartbeat. طيب, the normal heartbeat of a fetus is between 110 to 160 beats per minute. طيب, or heart rate يعني. Malformations for this, we use a fetal ultrasound, which is this right here on the left. This is a fetal ultrasound. طيب. And you guys need to know what this device looks like and what it's used for. And you need to know what a fetal ultrasound looks like and what it's used for. The fetal ultrasound is used to detect any malformation in the baby. And this is what it looks like, okay? Now, when we try to vaccinate a mother while she's pregnant, we need to take extra care because we're not only considering the health of the mother, we're also considering the health of the fetus, right? So there are three main rules when vaccinating a pregnant woman. First, we can't give her live attenuated vaccines, okay? While she's pregnant. And the reason for this is because live attenuated vaccines, we're going to get into vaccines, but live attenuated vaccines are basically weakened form of the virus or weakened form of the pathogen generally, okay? They're so harmful to the actual baby because the immune system of the baby or the immune system of the fetus isn't developed. Therefore, they need to be taken at a month or more before pregnancy. Now, dead vaccines like hepatitis A can be given at any time before pregnancy. طيب. And these still can't be given during pregnancy, but they can be given at any time before pregnancy. Dead vaccines is basically a vaccine or a virus or a pathogen that is injected, طيب, which is dead. Okay, it's not weakened, it's completely dead. طيب. Now, after pregnancy, we can give any vaccines. And this makes sense because خلاص, the baby's gone. We're not considering the fetus anymore, so we can give any vaccines. طيب. Now, what vaccines are recommended during pregnancy? Tdap, flu, and the COVID-19 vaccine. طيب. Now, Tdap is extremely important. For Tdap, one dose is recommended during pregnancy, and this is to prevent the fetus from getting something called whooping cough or pertussis. Now, ideally, this vaccine should be given between 27 to 37 weeks of pregnancy, towards the end of pregnancy. Whooping cough is a very common disease, okay, in babies, okay? And the reason why we give the mother the whooping cough vaccine is because when she's pregnant is because her body develops antibodies, طيب, her immune system develops antibodies, and these antibodies can move and they can go to the fetus's circulation so that by the time the fetus is born and the fetus becomes a baby, in the first 2 to 3 months of their lives, they can be prevented from getting pertussis or whooping cough. يعني they can be protected against pertussis or whooping cough. طيب. Some of you guys might think, okay, why can't we just vaccinate the baby in the first 2 to 3 months? The reason for this is because the immune system of the baby is underdeveloped. طيب. So we can't vaccinate the baby until after 2 or 3 months, and then we're going to vaccinate the baby against whooping cough. But in the first 2 to 3 months, they rely on the mother's antibodies. طيب. Now, what should happen in the postnatal period? How do we take care of the mother in the postnatal period? First off, the woman should be given adequate nutrition, طيب, and she needs to move lightly as soon as appropriate after birth. يعني as soon as it's appropriate, we need to let her move lightly. And this is extremely important. It was asked about before, تمام? She should also be provided with psychological support and family planning. Now, important definitions. A newborn or a neonate is a baby all the way from when they're born up to 28 days of life. Now, this time period is crucial. It's essential, okay? Because this time period is the time period where the baby is at the highest risk of dying. طيب, and know this, up to 28 days is when the baby is at the highest risk of dying. An infant is a baby from birth to 12 months, a toddler from 12 to 36 months, and a child is anyone who's under 18. طيب, you just need to know these classifications or definitions. Stillbirth is when a baby is born and there is no signs of life present during or after birth. خلاص, there's no signs of life. That's stillbirth. Stillbirth from the word stillbirth. طيب. Now, infant mortality rate, the way to calculate it is infant death divided by live birth times 1,000. Notice in هنا we don't use 100,000, we use 1,000, okay? So don't get it confused with the maternal mortality rate formula. طيب. Now, how do we reduce infant mortality rate? Immunization, we immunize the baby, we give them vaccines, طيب, or her. Clean water and pasteurized milk, okay? We provide them with clean water and pasteurized milk. Obviously, because they need clean water and pasteurized milk, or else they might get infected. Prenatal care and improved nutrition. تمام. طيب. What are the leading causes of neonatal death globally? First, you have preterm birth, yani the baby is born before the time that they're supposed to be born at. Birth defects and infections. Now, social determinants of neonatal health are basically anything that affect the health of the neonate, but they're not directly medically related. Like what, مثلا? The country that the baby is born in. طيب. Does that country have good laws when it comes to maternal and child health? طيب. Socioeconomic factors, the specific family. Is its income good? Is the living condition good? طيب. Maternal factors, the nutrition of the mother. How old is the mother? Does she smoke? طيب. Environmental factors, like is the water clean? Is the cooking fuel clean? You get it. You get the point. It's basically anything that affects the fetus's health, طيب, or the neonate's health, معلش, that isn't directly um, medically related, okay? And we're going to get into the social determinants of health later on in this crash course, and inshallah that will help you understand this better. طيب, preterm birth is delivery before the complete 37 weeks of gestation. Usually, the fetus is supposed to spend 37 weeks in the mother's womb, طيب, and if they're delivered before that, this is called preterm birth. Now, this could cause neonatal death because of two reasons: respiratory failure and intraventricular hemorrhage. And this is because the respiratory system and the cardiovascular system aren't completely developed yet. طيب, how do we reduce it? How do we reduce preterm birth? We educate the women at childbearing age, يعني we educate them, طيب, and we identify the specific women, طيب, who are at high risk of preterm labor, okay? طيب, who are these women at high risk of preterm labor? We identify them and we target them, طيب. Who are these women? Any woman that has had a previous preterm delivery, any woman that is older than 35 or younger than 18, any woman with a chronic disease, and any woman with a BMI under 19 or over 30. طيب, know these, know all of these. Okay, especially the BMI ranges and the age ranges are very important. Now, what are birth defects? Birth defects is when a baby is born with any type of congenital abnormality. Any type of congenital abnormality is known as a birth defect. Now, how do we prevent these birth defects? Genetic testing, simply. And we can test the genes of the mother, the genes of the father, see if they have any risk of giving birth to a baby with certain diseases like cystic fibrosis, like sickle cell disease, like thalassemia. Okay. طيب, we can also give immunizations against rubella because rubella is a virus that causes malformations in the fetus. Okay. If we give immunizations against rubella, we can prevent the malformations in the fetus. Okay. Also, we need to check the thyroid function of the fetus because the thyroid function tells us a lot about the brain and the bone development of that baby. طيب. Now, sudden infant death syndrome is basically a condition where the infant dies suddenly, okay, from the name. يعني خلاص, the infant dies suddenly, okay? This is a very common condition. And it happens because of a lot of reasons, but the main reason is because the baby is put to sleep on their stomach instead of their back, okay? So this baby right here is put to sleep on his stomach instead of his back. They're at risk of sudden infant death syndrome, تمام? But this baby right here is put to sleep on their back, so that's good. طيب, that's how it's supposed to be. Now, sudden infant death syndrome could be caused because of other reasons, like being overheated, bed sharing, and soft bedding. Okay? Know these three reasons and know the point about being put to sleep on their back or on their stomach. طيب? Now, bed sharing basically means when the parents, like, let's say the parents are excited that they got a baby, so they start sleeping in the same bed as the baby. Okay? That's called bed sharing. طيب, this was actually given as a case. No, two parents were excited that they got a baby, so they slept in the same bed as the baby, or the baby died. That's bed sharing, okay? Sharing the bed with the baby, basically. I don't know why I'm overcomplicating it, okay? Okay. طيب, now, these are the do's and don'ts lists for safe sleep. I want you guys to memorize like at least four or five of these in case it gets asked as an SAQ, okay? Right, now for some car seats. Car seats are very high yield. For car seats, all you need to know is the type of car seat and the age in which it needs to be given at the time. Okay. So this is the rear facing car seat. Okay. And it needs to be given or used from birth till the age of 2 to 3. It's called the rear facing car seat because this is the rear and this car seat faces the rear. Okay. Forward facing car seat, it needs to be given until the age of 5. طيب. Booster seat can be used until the age of 9 to 12. And then after that, after the age of 12, you can just sit in the back normally. Rear seat, normal rear seat. And yeah, okay. Obviously not the front seat, and they need to be wearing a seatbelt. These pictures, all of them, they're very important. طيب. And the age ranges as well, they're important. Okay. Now, the mental health of children. 10% of children experience mental health disorders, including ADHD, autism, depressive disorders, and anxiety disorders. 10% is a very important number. Other childhood conditions include tooth decay and child disability. Now, what are some contraceptions or contraceptives that can be given to women? Let's say the mother doesn't want to have a baby. It's too much hassle. طيب, she needs contraceptions, okay? Now, first we have combined oral contraceptive pills, which are these pills basically right here. طيب, and they're used for routine contraception, which means like just normal contraception, day-to-day contraception, okay? And they should be given at day 5 of the menstrual cycle for 21 days, and then a 7-day break, and then a new cycle begins. طيب. You need to know the cycle. In day 5 of the menstrual cycle, 21 days, 7-day break, and then a new cycle begins. Now, Depo-Provera injections are given once every 3 months. Um, that's about it for Depo-Provera. Given once every 3 months. You need to know the timing, okay, and you need to know what they look like. Now, IUD, again, you need to know what this device looks like. It's called an IUD device. There are two types of IUD. Copper IUD, which lasts for 10 years, but copper IUD isn't used for women with heavy menstrual bleeding because copper IUD can cause heavy menstrual bleeding. طيب. Finally, hormonal IUD lasts for 5 years. طيب. And this one can be used for women with heavy menstrual bleeding. طيب. And it lasts for less. Okay, but these are like long-term contraceptives. IUD generally is long-term. Now, family planning, which includes the use of contraceptives, enables the partners to control when and if they want to have a baby. And this promotes healthier pregnancies in families because um, because if you have a baby and you don't really want the baby, you're less likely to take care of the baby. تمام? If you have proper family planning and you only have a baby when you want to have a baby, this is going to promote healthier pregnancies and families overall. طيب, now let's solve some questions. We're basically done for maternal health. Uh, which of the following is the most critical time for a baby when the risk of death is the highest? The correct answer is A, within 28 days. We did this. We said no, the first 28 days are the most dangerous period, or is the most dangerous period in the baby's life. Okay, it's when the risk of death is the highest. Now, what death is classified as maternal mortality, or when is the death is classified as maternal mortality? The correct answer is C. طيب, within 42 days of delivery and during pregnancy. We said no, if a baby dies during pregnancy or within the 42-day period after pregnancy, that's called maternal mortality. طيب, vaccines across lifespan. Now, both public and primary healthcare play a role in vaccination. Public healthcare designs the vaccination policies, right? So, for example, they're like, okay, this vaccine needs to be taken at 3 doses method. Okay. And they monitor the whole population coverage. Okay. They focus on the population. That's the main thing. Primary healthcare focuses on individual care and bringing vaccines to specific people. For public health, makes the laws, makes the rules, طيب, and it monitors the whole population. Primary healthcare focuses on individual care and brings vaccines to people. Now, there are certain components of a vaccine that you guys need to know. First off, the antigen. The antigen is recognized by the immune system and it causes an immune response. Simple as that. Okay? It's the part of the vaccine which causes an immune response. Stabilizers maintain the effectiveness of the drug during storage. What that means is that they help store the drug. Stabilizers, they stabilize the drug. Adjuvants, add from added, طيب, they're added to provide an extra production of antibodies. I mean, they stimulate the production of antibodies extra. Obviously, antigens are supposed to they're supposed to stimulate the production of antibodies. But adjuvants are added to stimulate even more production of antibodies and give an even stronger immune reaction. طيب. Now, antibiotics are used in small amounts to prevent the contamination, and to prevent bacterial contamination of the vaccine. Now, this is a bit of a heavy slide. What are the types of immunity? First, you have natural immunity. طيب. Let's say I get COVID, for example, and then after that, I never get COVID again. The reason for this is because my body developed immunity against COVID. Okay? خلاص, my immune system made memory cells, produced antibodies, all of that good stuff. and I am now naturally immune to COVID because I got the disease I got the disease and I'm never gonna get it again. Or I'm not gonna get it again for a long amount of time. Not never, but for a long amount of time. طيب? Because of the production of memory cells. Okay? Herd immunity occurs at a population level. And it occurs when either 80% of the population is vaccinated or when 90% of the population is infected. Okay? And herd immunity is extremely important because when the whole population is immune, طيب, there are certain people طيب, who can't take the vaccinations. Like what? Like older people, like babies, they can't take the vaccination. تمام? They, يعني their immune systems are too weak. So therefore, when the whole population is immune, we protect those vulnerable members of the population. تمام? We protect them. Okay? Now, passive immunity is just ready-made antibodies transferred from either a animal or a person to another person. طيب? Now, in diseases like rabies, passive immunity or passive antibodies are given. And the rabies vaccine has passive antibodies. And the reason for this is because these diseases require quick intervention. طيب? Immediate intervention is necessary. Okay? So therefore, we just give them antibodies. طيب? Now, artificial or active immunity is the type of immunity that you get from vaccination. طيب? يعني when we get vaccines, تمام, we get exposed to weak forms of the pathogen. Okay? So our body develops memory cells, antibodies, all of that. That's called artificial immunity or active immunity. Now, what are the drawbacks of achieving herd immunity? طيب. If we achieve herd immunity through vaccination, there are certain advantages that we mentioned. طيب, but what are certain drawbacks? First of all, إنه the vaccine's effect can wane over time. طيب, therefore, we might require revaccination. And secondly, people may not get all the shots that they need to get protected from a disease. And they could get مثلا one shot and skip the second shot, مثلا, as an example. Okay. Now, through infection, pretty self-explanatory. We need 90% of the population to be infected in order to achieve herd immunity. And صراحة, this is very inconvenient because a very large number of the population can die. Okay, depending on how severe the disease is. But we never want 90% of the population to get infected. تمام? Achieving herd immunity through disease is very disadvantageous. Now, live attenuated vaccines are vaccines that contain live weakened pathogens. Okay, and they mimic natural infections, which means that they act like natural infections. Okay. And this generates a strong immune response. So if you have weakened pathogens, you inject someone with weakened pathogens, okay? The body's gonna think, oh, there's a disease, right? And it's gonna produce an immune response, طيب? And this is basically what live attenuated vaccines are. Now, the advantages of live attenuated vaccines, إنه the memory cells form. So there's memory. So if you get the actual disease, you're more likely to fight it off, طيب, due to the formation of these memory cells. And the immunity is strong and long lasting. Okay. Because of the development of memory cells, because of the development of antibodies. And also, a few doses are needed because of how strong the immunity is. But disadvantages is that immunocompromised individuals can't take them. People with weak immunities could cause the actual disease in people with weak immunities. Now, people who have normal immunities that aren't weak, they could also get the disease, but this is very rare. Okay. Now, there's also risk of contamination. The vaccines can get contaminated. Also, they need to be kept cool because they're alive. صح? They're alive. They're alive. Okay? So they need to be kept cool so that they don't die. طيب? The pathogens. So therefore, they don't travel well. Now, heterogeneous vaccines are a subgroup of live attenuated vaccines. Yani they're a part or a subgroup of live attenuated vaccines. And these are produced from different strains of the pathogen. A very important example of this that you guys need to know is BCG. BCG is a heterogeneous vaccine. It's given against tuberculosis, right? And tuberculosis is caused by a bacteria called Mycobacterium tuberculosis. طيب. However, the bacteria that we inject into the person, or the weakened form of the bacteria that is injected into the person, is Mycobacterium bovis, right? So this is a heterogeneous vaccine because we're injecting a different species. تمام? Okay? Now, inactivated vaccines contain a killed pathogen. Okay? So live attenuated vaccines contain a weakened pathogen. This one contains a killed pathogen. The pathogen is completely killed. Now, advantages of this is that they can be given to immunocompromised people, right? Because the pathogen is killed, so it's not going to cause anything, it's not going to cause a disease, okay? It's easy to store and produce. طيب, you can store it and produce it easily because the reason why it's easy to store is because خلاص يعني it's dead, it doesn't matter what temperature we store it at, and it cannot cause the disease. Okay. Again, it can't cause the disease because it's dead. Okay. Now, the disadvantages are because it's dead, the body doesn't produce that strong of an immune response against it. The immune response is weak. Also, multiple booster doses are needed. Now, subunit vaccines contain only the antigenic part, or the part that causes the disease, instead of containing the whole pathogen. And instead of containing this whole thing, they only contain this small part right here. Okay? Now, advantages of subunit vaccines is that there are no live components of the bacteria, or the virus, or the pathogen generally. No live components. تمام? It's safe. You can take it normally, it's safe and it's stable. طيب? The disadvantages are that the memory response that is produced is weak. Okay? Because you're only giving the antigen, the memory response is weak. Okay? Also, it is costly to develop because the process of separating the antigen from the pathogen is a costly process. Now, toxoid vaccines, we get the toxin, tamam, or that is produced by the pathogen or the bacteria. I think it's the bacteria, يعني. But so we get the toxin that is produced by the pathogen generally, and we basically treat this toxin to make it inactive. Okay, so now this toxin is inactive, طيب, and it can't cause the disease. However, it can still produce an immune response. It's extremely effective against the bacteria whose main harmful effects are through the toxin. طيب. But the disadvantage is that the immunity is against the toxin and it isn't against the bacteria itself. So therefore, booster shots may be needed. Okay? May need a booster shot. Now, for COVID-19 vaccine types, there are two main types, mRNA vaccine and viral vector vaccine. طيب. And you guys need to know how they work. For mRNA vaccines, we develop the mRNA that codes for this spike protein in the lab. Okay? When we develop this mRNA, we inject it into the person, okay? And it goes to the human cell. And then it is translated, forming the spike protein. Now, this spike protein is going to be recognized, and the body is going to be like, oh, we have COVID-19. Okay? And they're going to produce antibodies. Now, these antibodies provide us with immunity, okay? For the viral vaccine, we're going to remove the genetic material from the COVID-19 virus itself, طيب, the DNA يعني, and then we're going to put it into another virus that is harmless, okay? Treated virus to make it harmless. طيب, and then we inject it again. طيب, and then the same thing happens. The only difference is that this is the DNA. طيب, this is a DNA. So it needs to be transcribed and translated. Okay? And it gives us the spike protein, which is going to produce antibodies. تمام? Which is going to cause the body to produce antibodies. طيب, فهنا we take the genetic material from the actual COVID-19 virus, we put it into a harmless and untreated vector virus, طيب, and we put that vector virus into the human, we inject it, طيب, and it goes to the cell, transcribed, translated, forms the spike protein, antibody produced, طيب, as a response to the spike protein. هنا, we actually manufacture mRNA in the lab, we take this mRNA, put it into the human, we inject it into the human, يعني. This mRNA is translated, it forms the spike protein. For these antibodies are produced in response to that spike protein that is formed, and this provides us with immunity as well. طيب, what are some benefits of vaccination? First, health gains. طيب, reduction in mortality and morbidity. يعني the mortality, the death, طيب, and the morbidity, the suffering, they're both going to decrease. طيب, health cost savings. The health costs are going to decrease because if you treat someone, طيب, it's very expensive to treat them after they get the disease. The disease. What you should do, or what is more cost effective to do, is to prevent them from getting disease in the first place. To prevent them from getting the disease in the first place. And this is what vaccination does. Now, we also have care-related productivity gains and outcome-related productivity gains. Basically, because you got vaccinated, you're not going to get sick, you're going to be more productive. طيب, and care-related productivity gains is basically يعني مثلا if you have a child, okay, and that child doesn't get vaccinated, you're going to need to spend a lot of time taking care of them if they get the disease. Now, if they don't get the disease, طيب, you can be more productive, okay? You can do other things. That's productivity gains as well. Now, this is the second part of this lecture. You guys, unfortunately, need to memorize which vaccines are live attenuated, which vaccines are inactive, and which vaccines are subunit. This is the table right here, okay? Now, in this part, this is صراحة the worst part of cum, in my opinion. It's just a bunch of things that you guys need to memorize, really. You need to memorize the disease causing, or the disease, sorry. And you need to memorize how it's transmitted, طيب, and then the vaccine and the doses, okay? And the timing of the doses. So the disease, how it's transmitted, the vaccine, the doses, and the timing of the doses. So hepatitis B is transmitted through the blood or other bloody fluids, okay? It can be transmitted at birth from an infected mother, okay? يعني if the baby is born, طيب, the baby can get it from the infected mother. And symptoms include fever, vomiting, abdominal pain, and most importantly, jaundice. This is right here is jaundice, yellowing of the eyes and yellowing of the skin generally. طيب. Now, the vaccine is hepatitis B vaccine, and it's given at 3 doses at birth, and then 1 to 2 months, and then 6 to 18 months. Okay? Rotavirus is transmitted through the mouth. طيب. And infected people shed the virus in their stool. Now, the symptoms of rotavirus include watery diarrhea and vomiting. The vaccine for rotavirus is known as the RV vaccine. And this vaccine is given at 3 doses at 2, 4, and then 6 months. Diphtheria is transmitted by the air. Tetanus is transmitted from dirt, طيب, when dirt makes contact with wounds. And pertussis is also transmitted by the air. Now, if you guys remember, we talked about pertussis in the maternal child health lecture. We said it causes whooping cough, صح? Yeah, it's just repeated again, and it causes severe cough and difficulty breathing. طيب. Now, they all have a common vaccine, and this vaccine is DTaP. Remember DTaP? We said pregnant women should take DTaP. Now, DTaP doesn't only protect against pertussis. It also protects against diphtheria and tetanus. طيب. Now, it's given at 5 doses at 2 months, and then 4 months, and then 6 months, and 15 to 18 months, and then 6 years. Okay. This right here is diphtheria. You might get this picture, and they might ask you, "What is this?" And you're gonna say diphtheria. تمام. This white thing on the back of the throat, that's diphtheria. طيب. That's very high yield to know. Now, what about common diseases from? What are some other common diseases, معلش, from birth to 6 years of age? Right now, we're talking about common disease from birth to 6 years of age, okay? We finished hepatitis B. Now we have Haemophilus influenza type B. This is transmitted from the air, طيب, and it has no symptoms, okay? Now, it's the second most common cause of bacterial pneumonia in children, and it also causes meningitis. But the most important thing to know is that it's the second most common cause of bacterial pneumonia, طيب. Now, the vaccine is called the HIV vaccine, and it's given at 4 doses at 2, 4, 6, and then 12 to 15 months. Polio is transmitted fecal-orally, طيب, or from person-to-person contact. It causes fever, sore throat, and paralysis. Now, there are 2 vaccines that we need to know about in polio. The intramuscular polio vaccine, IPV, and the oral polio vaccine, OPV. The intramuscular vaccine is given at 4 doses at 2, 4, 6, 2, 4, and then 6 to 18 months, and then 4 to 6 years as well. The oral vaccine is given at 3 to 4 doses at 6, 10, and 14 weeks. طيب. Now, varicella or chickenpox, it's associated with fever, fatigue, and rash, and it's transmitted through air. But it also causes these vesicles, right? These fluid-filled blisters. طيب. And the vaccine is a 2 dose series that is given at 12 to 15 months and then at 4 to 6 years. طيب. For 2 doses, one at 12 to 15 months and the other one at 4 to 6 years. Pneumococcal bacteria is transmitted through air, no symptoms. Pneumonia is the most common cause, but it could also be caused by meningitis. Now, the vaccine is PCV13 and is given at 4 doses at 2, 4, 6, and then 12 to 15 months. Okay. Measles, mumps, and rubella all have the same vaccine, which is called MMR. Now, measles is transmitted through the air and causes cough, coryza, and conjunctivitis, the 3 Cs. تمام. Rubella is transmitted through the air as well and causes swollen lymph nodes. Mumps is transmitted through the air as well and it causes swollen salivary glands. طيب. Now, the vaccine for this is MMR and it's taken at 2 doses. طيب. At 12 to 15 months and then 4 to 6 years. Hepatitis A also causes jaundice, just like hepatitis B, طيب, and is transmitted through the fecal-oral route or contaminated food and water. Other symptoms other than jaundice, we have fatigue and nausea. The vaccine is hepatitis A vaccine, 2 doses, separated by 6 to 18 months between the first and second birthdays. Now, we also have influenza, which is transmitted through air and it causes fever and chills, as well as a cough, sore throat, and a runny nose. Now, for children from 6 months to 8 years, the influenza vaccine should be given at 2 doses, 1 month apart, and then 1 dose yearly. And for children that are 9 years and older, 1 dose yearly is enough. Now, HPV. HPV is a vaccine that is actually given to prevent certain types of cancer. Okay. And most people with HPV actually show no symptoms. Okay. And most HPV infections are healed without treatment. However, the HPV vaccine should normally be given at ages 9 to 14. طيب? 2 doses, and these doses should be 6 to 12 months apart. For people that take the vaccine late, at age 15 or later, a 3 dose series is recommended. طيب? At 0, 1 to 2, and then 16 months. Okay? Or 6 months, sorry. 0, 1 to 2, and 6 months. My bad. Now, HPV, again, we said it's used to prevent against cancer, but it's controversial. First of all, because it's very expensive, and also because it only prevents against 70% of genital cancer. Also, it protects against cervical cancer, but even after women take it, they still need regular screening for cervical cancer. Okay? Now, there is a concern regarding its side effects. It could cause side effects, and it is really unclear how long the immunity lasts for. Okay, there's not enough research on that. Now, what about for people older than 50? They also need certain vaccinations. These vaccinations are influenza, Tdap, shingles, and pneumococcal vaccines for people older than 65, and really old people. طيب? So, influenza, Tdap, shingles, and pneumococcal vaccine. طيب. Now, what is shingles? Shingles is caused by the same virus as chickenpox. We know that chickenpox is caused by varicella, صح? We discussed it previously. In children. Now, this varicella virus could remain dormant, يعني it could remain يعني it could just chill in the nerves for a while, and then it could reactivate later on in life, causing shingles. This right here is what shingles looks like. It's very important to memorize this. It's very important to know how shingles looks like. Right? Now, this is a table that I made. To help you guys memorize the vaccines, I made it by ChatGPT. I'd say it's a pretty good table, pretty accurate overall, except for this little part right here, this text overlap. I don't know, ChatGPT does that sometimes. But yeah, other than that, it's a pretty good table to help you guys memorize everything. It basically covers everything that we took in this second vaccination lecture, okay? طيب, now for Hajj, certain vaccines are required in order for you to go and do Hajj. And the reason behind this is because there are a lot of people in Hajj, صح? There needs to be some control over the spread of disease. طيب. The first vaccine that is needed is called meningococcal meningitis, and it's taken at no more than 3 years and at no less than 10 days for all travelers. Yani, you can't take it at less than 10 days before you go to Hajj, and you can't take it more than 3 years before you go to Hajj. Okay? So it needs to be in between. Yellow fever in high risk areas, and if you come from a country where yellow fever is very common, you need to take the yellow fever vaccine. Polio, we said that there are 2 vaccines for polio, OPV and IPV, and at least 1 dose of OPV and IPV are needed طيب, from areas that report cases of polio. طيب, and this is needed no more than 12 months and no less than 4 weeks. What that means is that you can't take it less than 4 weeks before going to Hajj, and you can't take it more than 12 months before going to Hajj. Now, COVID-19, 2 doses are needed only for people that are older than 12. طيب, these are the vaccines that are required, okay? What about the vaccines that are recommended and that they recommend for you, but they're not required? Influenza, hepatitis A, hepatitis B. طيب, influenza, hepatitis A, hepatitis B. Pretty simple. Now, on to some questions right now. We're finally done, alhamdulillah, from the vaccination lecture. Which of the following is a heterogeneous vaccine? The correct answer is A, BCG. We said previously in the important example of heterogeneous vaccines is BCG. This was a past question, by the way. Every single question that I have on this crash course is a past paper question. طيب. We said previously in BCG طيب, is a heterogeneous vaccine, and it basically uses a form of bacteria called Mycobacterium bovis instead of Mycobacterium tuberculosis. تمام? So the answer is A. Okay, and that's what a heterogeneous vaccine is. It uses a different strain of the pathogen. Okay, but it's the same as live attenuated and everything else. The only difference is that it uses a different strain. Now, which of the following is true about herd immunity? Correct answer is D. We mentioned previously, in herd immunity protects vulnerable members of the population who can't take the vaccine. So when the whole community around them is immune, they won't need the vaccine. They can just become protected. طيب. Yeah, the answer is D. طيب. Now, on to the next lecture, oral health across lifespan. Now, why is oral health important? Oh, what is oral health to begin with? Oral health is a natural, functional, and acceptable dentition which enables individuals to eat, speak, and socialize without discomfort, pain, or embarrassment for a lifetime, and which contributes to general well-being. You need to know this definition generally, يعني. You just need to know يعني, what oral health is. إنه it's a natural, functional, acceptable dentition, okay? And that enables individuals to eat, صح, you need your teeth to eat, speak, socialize without discomfort, pain, or embarrassment for a lifetime, which contributes to general well-being. I don't know why I said it twice, صراحة. طيب, why is oral health important? Okay, why is oral health important? It is important because people with oral health issues suffer from serious health and economic burdens, and this greatly reduces their quality of life. طيب, oral health affects people physically, it affects how they look يعني psychologically. طيب, يعني if your teeth are kind of messed up, you're going to be psychologically affected, and it influences how people grow, enjoy life, look, speak, chew, taste, and socialize. يعني this isn't that important. You just need to know generally إنه إنه يعني oral health is important for you. Okay. Now, what are the risk factors that are associated with having a bad oral health? طيب. Smoking. Okay, smoking could lead to a bad oral health. Alcohol, poor dietary habits. تمام. We also have poor oral hygiene, xerostomia, which means dry mouth. طيب. For all of these contribute to bad oral health. Now, oral diseases are preventable. تمام. They're very preventable. Okay, but they're very common in low and middle countries. Okay, low and middle income countries. This is because low and middle income countries lack a well-developed primary care. They don't have a well-developed primary healthcare system. Okay, because of that, oral diseases or oral health issues are more common there. Now, pregnant women, children, and the elderly are also vulnerable to healthcare issues or health or tooth health issues or oral health issues. تمام. Now, the enamel is the hardest part of the tooth, okay? And this part of the tooth contains the highest percentage of minerals. You need to know this, okay? This part right here is the enamel. If the enamel decays, right, this is called tooth decay or caries. Now, caries occur because of the interaction of bacteria and sugars with the teeth. The specific type of bacteria is called Streptococcus mutans, okay? For the interaction of Streptococcus mutans and sugars with the teeth is going to cause dental caries, okay? This right here, okay? What are the stages? First of all, what is early childhood caries? Early childhood caries is a very common chronic condition in children, okay? And this causes symptoms like pain and difficulty chewing, okay? Now, early childhood caries, um, the most important thing for you guys to know about it is that it is the most common chronic disease in children, okay? This is a very commonly asked question. What is the most common chronic disease in children? The answer is early childhood caries. Now, early childhood caries, the early stage of early childhood caries, the tooth are white. طيب, they look like this, تمام? And then they become brown. There's brown cavitation, right? And then the advanced stage is black. So you need to know how all of these stages look like. This is advanced. This is the second stage where it becomes brown. Or this is the first stage where it's just white, تمام? Now, periodontal diseases is basically the inflammation of the gums or the gingiva. Now, there are two types. Gingivitis, which is a periodontal disease without bone loss or tooth detachment, and then periodontitis, which involves bone loss or tooth detachment. طيب. Now, periodontitis is the major cause of tooth loss in adults, okay? Now, this is right here is what gingivitis looks like. Now, gingivitis is usually caused by a plaque. طيب. Uh, this is what a plaque looks like. طيب. It's basically a collection of bacteria. Now, in some cases, it's not induced by plaques. طيب. And if it's not induced by plaques, that means they're caused by genetics or trauma. What are other causes of gingivitis? Okay, other than genetics, trauma, and plaques. We have systemic factors. طيب. Now, this is very important, the second one. Drugs like calcium channel blockers, which are antihypertensive drugs. So, which of the following causes gingivitis? The answer is antihypertensive drugs or calcium channel blockers. Okay, these drugs cause gingivitis. Okay. Now medications like phenytoin, okay, and malnutrition like vitamin C deficiency. Okay, they all cause gingivitis. Now again, gingivitis is the inflammation of the gums only, no teeth involved, no connective tissue involved. Here the teeth, يعني, they look normal, but the gums are inflamed. You can see that the gums, there's some fluid in there. Okay, they're puffed out. Now, periodontal diseases, or sorry, periodontitis or periodontitis, معلش, is gingival inflammation and the loss of the supportive connective tissue or the teeth. فit's the inflammation of the gums and the loss of the teeth. Okay, and this is present in 50% of adults. طيب. And smoking is an extremely major risk. Okay. طيب. Now, we prevent this by having good oral hygiene, brushing teeth, and flossing, as well as avoiding tobacco, because as we said, smoking is a major cause. Now, periodontitis can lead to adverse outcomes in pregnancy because the inflammation could cause preterm birth and low birth weight. طيب. If a pregnant woman gets periodontitis, uh, there's going to be inflammation, right? Now, this inflammation could lead to preterm birth and could lead to low birth weight. Now, what is the best way to improve infant oral health? How do we improve the oral health of the infant? By improving the oral health of the mother. طيب. This is also very high yield. It could be asked about. Simply, how do you improve the oral health of the infant? By improving the oral health of the mother. Okay. Now, oral cancer. There are two precursors for oral cancer, erythroplakia and leukoplakia. This is what erythroplakia looks like. You can see the picture on the bottom right. Erythroplakia is black. Erythro means black, صح؟ يعني erythrocytes مثلا red blood cells black. Sorry, red معلش. Erythro means red. Erythro means red, okay? Erythroplakia is red. Leukoplakia is white. طيب. ف you can remember إنه erythrocytes, red blood cells, leukoplakia, leukocytes, white blood cells, you know? Erythroplakia is red, leukoplakia is white. Now, the most common location for oral cancer is in the lateral aspect of the tongue. Risk factors are alcohol and tobacco. You guys need to remember erythroplakia and leukoplakia very well. Erythroplakia is red, leukoplakia is white. طيب. They are the most common cause. They are the precursors of oral cancer. And the most common area of oral cancer is the lateral aspect of the tongue. Now, what is the role of the primary healthcare practitioners in promoting oral health? First, they identify the individuals at risk, okay? And then there's care assessment, education, and proper referral and follow-ups. Dental hygiene treatment, طيب. Fluoridation. Fluoridation is very important. Fluoridation is basically providing fluoride, طيب, to the teeth. Dental sealants, which are basically thin coatings that protect the tooth from cavity. And this protection occurs because the tooth is sealed, right? Now, fluoride is a mineral that is naturally present in water, okay? And it's present in different types of food as well. Our teeth are constantly gaining and losing fluoride at the same time through a process called demineralization, which is the process of losing fluoride, and then remineralization, which is the process of gaining fluoride. Too much demineralization without enough remineralization will cause tooth decay, and fluoridation can prevent 25% of tooth decay, okay? Now, community fluoridation is basically adding fluoride to water so that there's a consistent level of fluoride in the water supply that reaches everyone in the community. خلاص, you add fluoride to water so that the water supply that reaches everyone in the community has a consistent supply of fluoride, and this helps keep the teeth healthy. Now, on to the next lecture, healthful living, okay? طيب. Smoking is a major public health concern. It's a very big public health concern because it causes a wide range of conditions, okay? Now, there are 1.3 billion smokers around the world. 1.3 billion, okay? That number is very important. You guys need to know. طيب. Now, tobacco use kills 8 million people each year, okay? And around 80% of those 1.3 billion people, okay, 1.3 billion tobacco users, they live in low and middle income countries. تمام? Now, tobacco can contribute to poverty, okay? And this is because you might think, oh, how does smoking contribute to poverty? This is because, let's say, the father of the family مثلا, or the mother of the family, they smoke, okay? And if they smoke, a very big amount of their income, especially if they're really addicted, a very big amount of their income is going to go towards cigarettes. طيب. And if they're poor, this is going to divert the money that's supposed to go to basic needs like food and shelter, and it's going to go into tobacco. And this is very hard to fight because they're addicted, right? Tobacco is addictive. Okay. Now, smoking causes illnesses as well. This is another reason why tobacco contributes to poverty. It's because smoking causes illnesses, طيب? And these illnesses will affect the person economically. يعني when someone's ill, they spend more money on treatments وكده, فthey affect the person economically. Now, when do most people start smoking? This is extremely important, at ages 14 to 25. This could be an MCQ. They could ask you when do most people start smoking. The answer is 14 to 25. طيب. Now this, I took this from your lecture. It basically just shows you 83% of all smokers began smoking from هنا to هنا, from 14 to 25. تمام. Now, smoking is an epidemic. What is an epidemic? It is a condition or a disease that occurs at a higher rate than expected at a given population or at a given time. طيب. And this is what smoking is. طيب. Now, smoking is the leading cause of preventable death worldwide. Why is it preventable? Because you can prevent it, صح? You can stop smoking. It's the leading cause of preventable death worldwide. Now, it causes a wide range of complications, تمام? Like lung cancer. Fun fact, not a very fun fact, smoking causes 85% of lung cancer worldwide. Okay? 85% of the lung cancer cases around the world, they're caused by smoking. Okay? It could also cause conditions like COPD, heart disease, reduced fertility, dental problems, and premature aging. Okay? But the most important thing is lung cancer because it causes 85% of lung cancer globally, and you need to know this. It causes 85% of lung cancer globally. تمام? But this is just to show you, it causes other conditions as well. Okay? Now, what are the stages of smoking addiction? How does a person get addicted to smoking? Or how does a person get addicted to smoking? Reward pathway, basically nicotine, okay? It stimulates dopamine release in the brain. And this dopamine gives you a feeling of pleasure and reward, okay? And over time, the people kind of get tolerant to the dopamine that they get from smoking. So they need more cigarettes or more smoking in order to achieve that same feeling that they felt before. They try to chase that same high again, right? That same feeling again, okay? And this causes something called withdrawal symptoms. Withdrawal symptoms is when nicotine levels in the body drop, right? And because of that drop in the nicotine levels in the body, this causes anxiety and irritability. Okay, and it's like they itch for nicotine. Okay, so that's what withdrawal symptoms are. طيب, so these are the three steps, or the three steps of how a person gets addicted. تمام? Now, non-smokers are not safe from the harmful effects of smoking. Obviously, smoking is very harmful, as we've established, but it's not only harmful for the smoker, it's harmful for the person who's consistently around the smoker as well. This is called secondhand smoking, okay? Now, I didn't know this before I studied comm. Secondhand smokers actually have a 20 to 30% risk higher chance of cancer, and a 20 to 30% higher risk of cancer. So, like, even if you're not smoking, but you're around smokers and you inhale that gas, you have a 20 to 30% higher risk of cancer. طيب. Now, what are the chemicals in tobacco? Nicotine is the naturally occurring alkaloid and it's responsible for addiction. Okay? Nicotine is responsible for addiction. Tar is the sticky residue that is formed from burning and it's carcinogenic. What you need to know is that tar is carcinogenic. طيب. Carbon monoxide is the toxic gas and it binds to hemoglobin in the blood, basically reducing oxygen delivery to tissues. Now, formaldehyde is a colorless gas released during combustion and it's also carcinogenic. So tar and formaldehyde are carcinogenic. طيب. Carbon monoxide reduces oxygen delivery to the tissues because it binds to the red blood cells or the hemoglobin in the red blood cells, and nicotine causes addiction. Okay. Now, what is vaping? Vape is a handheld electronic device, طيب, and it's used to inhale mist or vapor. They deliver flavored nicotine to the lungs, basically, and it's considered less harmful than smoking, and it can be used as a tool for smoking cessation. So if someone's addicted, we try to level the, يعني, we try to level the addiction down. So instead of cigarettes, مثلا, we give them vape. Okay, but it's still harmful because researchers don't have enough information on them. Not enough research has been done on them. They've only been around for 20 years or so. طيب. We don't have any information about their long-term health effects, basically. Now, smoking cessation can be through behavioral counseling, nicotine replacement therapy, medication, social support, and relapse prevention. Relapse prevention is the most important. You don't want them to go back to their old smoking habits, طيب? And that's called relapse prevention. Now, nicotine replacement therapy is also very important. And you're trying to replace the nicotine with something else. طيب? Now, empower may come as an SAQ, so you need to know what every letter in empower means. طيب? Empower is basically a set of guidelines established by the WHO. And the first guideline is M for monitor. Monitor tobacco use, okay? P, protect people from tobacco use. O, offer help to quit tobacco use. W, warn about the dangers of tobacco. E, enforce bans on tobacco advertising, promotion, and sponsorship. and R, raise taxes on tobacco. So you need to know Empower, you need to memorize Empower. And the reason is you might get it in an SAQ. It came in an SAQ a lot before. طيب. And even if you don't get it in an SAQ, it might come as an MCQ. Now, what are the differences between the old food pyramid and the new food pyramid? The new food pyramid is updated. طيب. It's a better version of the old food pyramid because the old food pyramid just gave estimated ranges of every food category. طيب. But the new food pyramid provides specific serving sizes for every category of food. تمام. That's the difference. Now, the old food pyramid provides, we said this, okay. طيب. Another thing is that the old food pyramid did not recommend whole grain, something called whole grain, a type of food. It wasn't recommended by the old food pyramid, but it's recommended by the new food pyramid. And also, the new food pyramid doesn't only include food, it also includes physical fitness, okay? So this is a picture of the new food pyramid. Now, how do we promote healthy eating? This can be done by increasing the availability of healthy food and making that healthy food affordable. طيب. Regulating the ads online about the food industry. I mean, the food industry ads. The food industry has a lot of like ads that promote unhealthy foods, so we could regulate that. Promoting educational campaigns طيب, to raise awareness about the benefits of healthy food and the harms of unhealthy food. طيب. And raising taxes on junk foods and soft drinks. This one's the most important. If you raise taxes on junk food and soft drinks, people are going to be less likely to buy them. Now, um, 7 to 10,000 steps per day is needed to maintain health. And basically, if you convert that to calories, it's basically from 150 calories, يعني 150 calories per day that needs to be burned, or 1,000 calories per week. طيب. And those are needed to maintain health. So keep those in mind, okay? Now, what are the levels of disease prevention? First of all, primary. Primary is preventing the disease before it happens. يعني this includes health programs to promote lifestyle as well as vaccination. طيب. If we promote a healthy lifestyle and we vaccinate, the people are less likely to get the disease to begin with. This is the whole point of primary healthcare, to prevent people from getting the disease to begin with. تمام? Now, secondary aims to detect early stages of disease. طيب. Includes pap smears and any type of screening. If they tell you, wallah, this person got screening for this disease, طيب, and it's like, what type of prevention is this? The answer is secondary prevention. طيب. Now, tertiary aims to reduce the disability or recurrence of a disease. Yani if a disease already happens, the aim of tertiary prevention is to reduce the recurrence of the disease or the disability that it causes, okay? For example, if a person had a myocardial infarction or a heart attack, طيب, we're gonna put them on certain physical programs, and this is gonna reduce their chance of getting a myocardial infarction again. طيب, reducing recurrence, okay? Now, uh, okay. So, malnutrition. We're going to start talking about malnutrition now. Malnutrition can be in two forms. It can either be undernutrition and overnutrition. A lot of people like to associate malnutrition with خلاص. It's just undernutrition. No. Even overnutrition is considered malnutrition. طيب. Now, we're going to get into this, but let me just start explaining it now. Undernutrition has four categories. You can either be underweight, which is just low weight for age, simple enough. Wasting is low weight for height. يعني the height is normal, but the weight compared to that height is low. Stunting is low height for age. Okay? Like your height is too low for your age. That's stunting. And then micronutrient deficiencies, being deficient in certain specific micronutrients. Now, overnutrition, you can either be overweight or you can be obese, which is the next stage. تمام? Now, malnutrition affects 1 in 3 people worldwide. Okay? And 1 in 3 people, okay, suffer from malnutrition. Now, what are the types of undernutrition? طيب, we discussed them. Wasting is low weight for height. طيب, due to not enough food being available or due to disease causing an acute disease causing diarrhea. Because diarrhea reduces weight. يعني when you're diarrhea reduces weight basically, okay? Now, stunting is low weight or low height for age. Let's say someone is of a certain age and the average height is مثلا in that age is 170 and that person is 140. طيب. That's low height for age, and that's due to chronic undernutrition. يعني continuous undernutrition for a very long amount of time leads to stunting, okay? Underweight means low weight for age. طيب. Know this. This is very important. Stunting and wasting and underweight. طيب. Again, wasting, low weight for height, stunting, low height for age, underweight, low weight for age. Okay. فthis just shows you in stunting, the height is low compared to the age. طيب. Wasting, the weight is low. They're very thin. طيب. This is a normal guy. And this guy is underweight. تمام. Low weight for age. Okay. Know the difference between those types of undernutrition. Inshallah, you'll do it. طيب. Now, what is SDG? SDG is Sustainable Development Goals, and it's a set of 17 global goals that are accepted by the United Nations. Now, what you need to know in this lecture is SDG 2. SDG 2 is focused on solving hunger. Best know that. SDG 2 is focused on solving hunger. طيب. Now, what are some key Saudi initiatives that help in reducing hunger, يعني focus on reducing hunger? First, the Saudi Grains Organization, SAGO, has initiatives to reduce food wasting, يعني wasting food. طيب. And the Ministry of Environment, Water and Agriculture have initiatives to improve food security or provide food security by rehabilitation of agricultural lands. They want to provide food security in like the country becomes secure in terms of food, and they want to do this by increasing the amount of agricultural lands, I guess. طيب. Now, undernutrition in children, 45% of deaths in children under 5 can occur due to undernutrition. طيب. أو occur due to undernutrition. All of the children that die under 5, okay, 45% of them die because of undernutrition. 45%, okay? So almost half. With low and middle income countries being worse affected than high income countries, which makes sense because children in low and middle income countries are more prone to having less food. They're more prone to being malnourished. تمام? Treatment reaches less than 15% of the affected children. Out of all of the affected children, less than 15% of them actually get treatment. Okay. Now, what are some signs of undernutrition in children? Weak muscles, changes in behavior, changes in hair and skin color. This is supposed to be skin. An increase in illness or infections. تمام. طيب. Now, how do we solve this? For children that are severely malnourished, like if they're very malnourished, and we can tell this based on like edema or swelling in the legs, as well as muscle wasting, we take them to the hospital immediately. طيب. This was written twice, ignore that. Now, for children that are moderately malnourished, we give them something called RUTF, and we request follow-ups. طيب, what is RUTF? This right here is an RUTF packet. You don't need to know what's in the RUTF packet. طيب. You don't need to memorize مثلا nine spears of asparagus. You don't need to know that. طيب. What you do need to know is that RUTF is given to children with moderate malnutrition. طيب. Now, this is the BMI curve, and you guys need to know a lot about this BMI curve. Actually, not even that much. Basically, they're going to give you the age. تمام. This is age right here, and this is BMI. طيب. And then, based on the percentile, you're supposed to tell if they're healthy or if they're overweight or if they're underweight. طيب. Between the 5th percentile to the 85th percentile, يعني all the way from here, all the way up to here, this is the healthy range. If they're above that, they're overweight. هنا overweight. طيب. يعني if they're in the shaded category right here, they're obese. Now, if they're below that, if they're below the 5th percentile, they're underweight. Okay? So between the 5th and 85th is normal. طيب. Above the 85th is overweight, and above this shaded line is obese. Below the 5th, underweight. Okay? Okay, now, this child right here has a certain disease called kwashiorkor. And kwashiorkor occurs due to low protein intake. Even if the calorie intake is normal, طيب, and the protein intake is low, children could have kwashiorkor. Okay? And how can you tell that it's kwashiorkor? Because of the bulging stomach. Okay? For low protein intake, kwashiorkor. Know this, very important. Now, this child has a different disease. It's called marasmus. And marasmus is due to low calorie intake, and the children look very skinny and frail. Okay? Yeah. The difference between kwashiorkor and marasmus is that marasmus symptoms include low weight loss, dehydration, stomach shrinkage, diarrhea, and kwashiorkor symptoms, stomach bulging, edema, inability to grow or gain weight. But the most important thing is their causes. Okay? Kwashiorkor is caused due to the lack of protein intake, طيب, and marasmus is caused due to the lack of calorie intake. Okay? Or due to low calorie intake. طيب how do you prevent malnutrition? Uh, Mothers need to breastfeed their children. طيب. Also, taking the deficient macronutrients need to be taken. يعني if a certain macronutrient is deficient, they need to be taken. And responding quickly and effectively to nutrition emergencies. If there's any nutrition emergencies, we respond quickly to that. طيب. And finally, we prevent obesity because obesity is also a type of malnutrition. Okay. Now, question: should mothers with HIV breastfeed their children? Yes. However, before they breastfeed their children, they need to receive the ARV medications first. طيب. Antiretroviral medications. Okay. طيب. Why should they breastfeed their children? They have HIV. It's simply because the benefits of breastfeeding outweighs the disadvantages. Okay. The benefits of breastfeeding with HIV outweigh the disadvantages if the antiretroviral medications are taken. Okay. So the baby needs to be exclusively breastfed for the first 6 months, and then introducing complement meals can happen after. And breastfeeding continues for 12 months or even up to 24 months in some cases. Okay. طيب. Being overweight actually leads to more global deaths. طيب. يعني leads to more deaths worldwide than being underweight. Obesity is considered a disease. Okay. Because it impairs the normal functioning of the body and decreases life expectancy. يعني صراحة I was shocked by this fact إنه being overweight leads to more deaths than being underweight. تمام. What's considered a disease. Why? Because a disease is anything that impairs the normal functioning of the body. And obesity impairs the normal functioning of the body. Okay? And it decreases life expectancy as well. It ticks both boxes. طيب. Now, these are some statistics you guys need to know. 39% of adults were diagnosed with being overweight and 13% were obese. طيب. يعني out of all adults, 39% are overweight and 13 are obese. طيب. Now, what is the waist to hip ratio? The waist to hip ratio is basically when we take the the length of the waist, and then we take the length of the hip, and we divide the length of the waist by the length of the hip, okay? And what you really need to know is that anything above 0.9 for males and above 0.89 in females is considered obese. That's it. A waist to hip ratio of above 0.9 in males and 0.85 in females is considered obese. Research shows that obesity can be associated with cancers like colorectal cancer, endometrial cancer, and breast cancer. تمام? Now, it's been a while. Let's solve some questions. طيب. A 56-year-old woman suffers from hypertension and difficulty remembering things. She has recently been complaining of red and swollen gums that have bled easily upon flossing and brushing. Further investigation found that she had inflammation of the gum without bone loss. Which condition is this? Pause the video and answer. The correct answer is B, gingivitis. Gingivitis is basically the inflammation of the gums, طيب, and the tooth or the teeth isn't involved. As we said, and we put the same picture, طيب, and this picture was in the past. This is a past question. تمام, for the answer is B. And the giveaway is inflammation of the gums without bone loss, as well as the picture. Which of the following is the most critical age group for preventing new smokers? The answer is C, 14 to 25. We talked about this. We said the most critical age group for preventing new smokers is 14 to 25 years old. Now, climate change and public health. What is climate change? Climate change is the long-term shift in the global weather pattern, and this leads to global warming. Now, this global warming didn't come on its own. It's man-made, and it's caused by the greenhouse gases, and this has been happening since the mid-20th century. Now, greenhouse gases, specifically carbon dioxide and methane, or especially carbon dioxide and methane, absorb and emit heat. And this absorption and emission of heat causes an increase in average global temperature. تمام? فthis shows you هنا إنه والله when the industrial revolution started, there was an increase in the number or in the average global temperature. طيب? Unlike anything else يعني all the way from the year 1000 to the year 1750, the temperature was chilling. طيب? And when the industrial revolution started, the temperature started to increase. It tells you, or it proves the fact that climate change is man-made, or is caused by the industrial revolution, or is caused by greenhouse gases like carbon dioxide and methane. طيب? Now, that's cool and all, but as doctors, we need to know how does this affect our health, or as medical students, we need to know how does this affect our health. تمام? An increase in the average global temperature is going to lead to an increase in ground ozone levels and harmful fine products. You need to know this. Ground ozone levels and harmful fine products increase with an increase in average global temperature, specifically ground ozone levels. That's what you need to know specifically. And ground ozone levels is very important. Now, ground ozone or ground level ozone, معلش, did I say ground ozone level? It's ground level ozone. تمام? Ground level ozone can cause difficulty breathing, shortness of breath, sore throat, wheezing and coughing. تمام. And fine particles as well can cause all the same things. طيب. بس there's a difference in what conditions they make worse. Ozone can make asthma and COPD as well as emphysema worse. Fine particles, طيب, can make cardiovascular disease and heart disease worse, and they can also worsen asthma and COPD. تمام. فboth of them worsen asthma and COPD. But the difference is that fine particles worsen cardiovascular and heart disease, and ozone can worsen emphysema. طيب. Now, this basically shows you the effect of these harmful gases on the lungs, the pancreas, the heart, the brain. I don't think you need to know these specifically, but it's just to give you a general idea إنه how harmful climate change is, right? Or how harmful the gases produced are, or the greenhouse gases يعني. طيب. Now, climate change and wildfires. Climate change increases the risk of wildfires. ليه? Because the trees, the vegetation, they become more dry. Due to this dry vegetation, uh, they can catch fire, the vegetation can catch fire more easily. Okay? Now, these wildfire smokes contain carbon monoxide as well as ozone precursors, and this reduces the air quality. طيب. Now, climate change and allergies. Higher temperatures will lead to longer warm seasons. For the seasons that are warm will lengthen. Okay? يعني effectively summer will lengthen. Not really, but يعني the warm seasons will lengthen. Okay? Just know that. طيب. And increased carbon dioxide also occurs, and this causes pollen seasons to last longer, طيب, and become more intense. Therefore, the allergies are going to increase, right? Allergies and asthma, all of that is going to increase. It's like a chain reaction. طيب. Harmful gases are produced. This causes the increased length of warm seasons. طيب. Therefore, the pollen seasons are going to become longer. They're going to become more intense, and this is going to increase the allergies and increase the chance of allergies and the chance of asthma as well. طيب. And reduce overall productivity. I mean, the productivity of the people are going to decrease because there's going to be more people that suffer from these allergies. صح? طيب. Now, extreme heat events basically means really high temperatures. طيب. And when you have a higher average temperature, the chance of extreme heat increases. Now, extreme heat is projected to be more common in the next few decades, and these events lead to an increased hospital admission from cardiovascular health issues, from kidney health issues, from respiratory diseases, and as well as death in some cases. Extreme heat causes a lot of issues like cardiovascular issues, kidney issues, طيب, and this leads to an increase in hospital admissions, and it could lead to death. طيب. Now, malaria is a disease that is transmitted by the female Anopheles mosquito or the Anopheles mosquito. طيب. The Aedes mosquito can spread Zika and dengue. Okay. If the temperature increases, طيب, those vector-borne diseases that we just mentioned are gonna their occurrence is gonna increase because the mosquitoes can survive for longer in warm seasons. They like warm seasons, تمام? This increases their survival, it increases their activity. Yeah, it's gonna lead to an increased spread of the disease. Now, waterborne diseases as well, higher temperatures will also increase the waterborne diseases. ليه? Because the pathogens that are in the water are going to survive for longer. Mental health effect, many studies have shown that يعني, extreme heat events or increased temperature or climate change in general has caused worse overall mental health results. يعني, the mental health became worse with suicide rates increased. طيب. Now, why is this unfair? It's unfair because if you think about it, most of the gases that are being produced, most of the harmful and toxic products are being produced in high income countries, صح؟ يعني مثلا the greenhouse gases, most of the factories that produce a large number of greenhouse gases, all of that, they're in high income countries. But high income countries can deal with climate change better than low income countries. So high income countries emit far more toxic gases while low income countries suffer more. So this is unfair. طيب, now what is being done about this? Two things, mitigation and adaptation. Mitigation is an action that is done to reduce the rate or magnitude of global warming, like reducing emissions. For example, electric cars, right? instead of driving normal cars, okay? Or like a factory trying to produce less gases. And you try to stop the problem itself. Adaptation is an action that is done to respond to the changes. Okay, so the changes already happened, now you're trying to respond to it. And this is our main job as physicians. طيب. Now, adaptation is also like secondary and tertiary prevention in خلاص it occurred, right? Mitigation is primary, it's trying to prevent it. But after mitigation, we have adaptation, which is just trying to adapt to the changes that already happened. Now, as physicians, we can also work on reducing the emissions from the healthcare sector, as well as spreading awareness about the harmful effects of climate change. Now, on to the next lecture, AI in medicine. First off, what is AI? AI refers to the simulation of human intelligence in machines, designed to perform tasks such as learning, reasoning, and perceptions, okay? You're basically trying to simulate human intelligence in machines. Now, characteristics of AI, first you have adaptability or machine learning. AI is data-driven, which means that it relies on large databases to make decisions. يعني large databases are used in order to make certain decisions. Automation, which means that it reduces manual tasks by mimicking human thinking. That's why it's able to reply so fast, okay? Because of automation. Now, narrow AI and general AI. General AI is not made yet, يعني it's just a concept, but narrow AI is what we use right now. Basically, narrow AI is weak AI. It lacks artificial consciousness, and it can't solve unfamiliar problems. And general AI is the opposite. تمام. But I don't think you'll be asked about this صراحة, very low yield. But in case you do, I just have the slide. تمام. Now, why do we need AI in healthcare? AI in healthcare is needed because it saves costs and it allows for more efficiency, right? And also it personalizes healthcare. Like it studies each individual case, طيب, it personalizes healthcare for each person. طيب. And it also addresses certain healthcare challenges because there are human errors, تمام. AI is less likely to make errors. And also increased demand for certain services. Certain services or certain fields of medicine don't have enough doctors. We can just use AI. Okay. Obviously, I'm saying we can just use AI, like doctors are completely replaceable. They're not. And we're going to know this by the end of the lecture. طيب. To leverage the data for better outcomes as well. يعني we have certain research data that we collected, and we want to leverage it. We want to use it for better outcomes. And we can use AI to do this. طيب. Now let's look at some real life applications of AI in healthcare. And this is the most important part of this lecture. AI can assist radiologists to diagnose conditions with speed and accuracy. طيب. You know, I don't know if you guys heard about this, but a lot of people are saying radiology is going to get replaced by AI and all of that. And it's kind of already happening because AI can diagnose conditions طيب, on chest x-rays like this. You might get this picture on the exam. And just know in AI can actually diagnose conditions. It can help radiologists diagnose certain conditions. Now, one more thing, actually two more things for applications. In pathology, AI can be used to analyze the biopsy slides for cancer diagnosis. And you can look at certain biopsy slides and help in cancer diagnosis and determining whether there's cancer or not. طيب. Finally, AI can be used to personalize treatment plans by analyzing genetic, clinical, and lifestyle data to provide customized treatment plans. And you can look at every person, every individual person, and look at the genetic information, look at the clinical, look at the genetic information, طيب, look at the lifestyle of that person, look at the clinical background of that person, and based on all of that, it can make customized treatment plans for every person. طيب. Now, oh yeah, one more thing. AI can be used in proactive care, something called proactive care. And believe it or not, proactive care is basically predicting undiagnosed conditions using electrical medical records or electronic medical records. Electronic medical records basically are like previous records of previous patients, and based on that, AI can predict a certain undiagnosed condition. طيب. مثلا this person was going through this before getting diagnosed with this. Okay, and now you're going through this. So you might have the same diagnosis as this person. Basically, that's how this works. Okay. Now, this might be hard for doctors because doctors, يعني, it takes a lot of time to go through the whole EMR. المهم, they're better at proactive care than doctors. تمام. AI can also assist in robotic surgeries, providing real-time recommendations to reduce errors. تمام. They can provide real-time recommendations to surgeons so that surgeons can reduce errors. Now, what are the problems with using AI in healthcare? We just discussed all of the advantages. Let's look at some disadvantages. AI models can reflect biases present in training data, perpetuating inequalities. What does this mean? Like, we know in AI works based on research, right? We said this. Based on the research that is available, the AI is able to make decisions. صح? But sometimes there are some gaps in the research. There are some biases in the research. يعني مثلا certain groups are studied more than others. طيب? And based on these biases, AI can make decisions, and these decisions can be wrong. طيب? That's what this means. Automation can also replace people's roles in administration and diagnostics. يعني doctors that are working in administration and diagnostics could get replaced, and obviously this is a disadvantage. Now, what are some problems? Yeah, okay. طيب, determining responsibility for AI remains unresolved. يعني مثلا, if an AI makes a mistake, who are you going to blame? Are you going to blame the company that developed the AI? Are you going to blame the doctor that said use AI in this hospital? Who are you going to blame? You don't know who to blame, صح? Determining responsibility is unresolved. مثلا, if you're a doctor and you make a problem or you cause a problem, you're going to be the one to blame, صح? But if AI does something wrong, who are you going to blame? That's the question right here. So, responsibility or determining responsibility is unresolved. طيب, now if AI misdiagnoses, should the liability fall on the developer, the institution, or the clinician? If a doctor misdiagnoses, we know who the liability falls on. It falls on the doctor. But if AI misdiagnoses, we don't know who the liability falls on. تمام? Dependence on AI tools could reduce critical thinking and expertise amongst clinicians. يعني clinicians could just be like, okay, let's just use AI for this, let's use AI for that. It reduces the expertise, the clinical thinking. طيب, or the critical thinking, my bad. طيب. Now, what are some challenges to overcome? First off, building trust in AI systems amongst patients and providers. طيب. A lot of healthcare providers, a lot of patients don't really trust AI in anything. طيب, because it's new. It's a new idea. Okay. It's very unfamiliar to get used to something new like that, especially in a sensitive field like medicine. طيب. Ensuring inclusivity in AI datasets to avoid bias. Again, remember when we said in the research or datasets of AI could be biased. طيب. Due to this bias, the decisions made by the AI could be biased. طيب. If you ensure inclusivity in the datasets, you're going to avoid bias as much as possible. Also, developing clear regulatory frameworks to govern AI usage. يعني we should develop frameworks to govern AI usage. يعني if you want to use AI, you need to do these three things مثلا. Okay? Rules. So just don't allow them to go crazy with AI. They need to use it within boundaries. Okay? Now, AI supports clinicians. It does not replace them. That's the main idea of this lecture. AI supports clinicians. It doesn't replace them. Now, on to the next lecture, refugee health. What are some common causes of refugee migration? Yani, why would someone want to leave their country as a refugee and go to another country? Wars and conflict, environmental factors, violence and discrimination, economic hardship. Pretty self-explanatory, tamam? And I'm sure even if you don't memorize this, you can come up with them at the exam. Yani, you could think. But I recommend memorizing them though. Like war and conflict, economic factors. War and conflict, environmental factors, like something wrong with the environment, like a natural disaster, for example. Violence and discrimination. مثلا, certain groups could be discriminated against. Economic hardship, يعني the economy in a country is not doing well, or people can't afford to buy certain stuff, they can't afford to live properly. طيب. Now, what are some common infectious diseases amongst refugee populations? طيب. Let's say a refugee population moved from one area to the other. Okay. And they're in refugee camps or whatever. طيب. And they're just together. طيب. What are some common diseases amongst them? Tuberculosis, HIV, HCV, and HBC. Okay, remember those four. Now, what are the numbers looking like? As of March 2023, 65 million people are forced to leave their home country. And 23 million of those are refugees and asylum seekers. Obviously, that number has increased since then. But these are the results from March 2023. Now, amongst asylum seekers generally or refugees generally, tuberculosis is the most common. صح, we said tuberculosis, HBV, HIV, and what was the last one? Tuberculosis, HIV, HBC, and HCV. طيب. And out of those, tuberculosis is the most common. طيب. Amongst asylum seekers. Communicable disease just means infectious diseases. Okay. The highest prevalence of HPV was reported in Asian and Eastern Mediterranean countries, طيب, and refugees from Asian and Eastern Mediterranean countries had the highest prevalence of HPV. Now, the highest HIV prevalence was reported in African refugees. طيب. Now, for generally, okay, one more time. Generally, the highest prevalence of is TB. طيب. In Asian and Eastern Mediterranean refugees, the highest prevalence is HBV. In African refugees, the highest prevalence is HIV. طيب. This might be important, فkeep it in mind. Now, what are some common non-communicable diseases, يعني non-infectious diseases in refugees? We have malnutrition, طيب, diabetes, okay, hypertension, iron deficiency anemia, maternal health problems, right, cancer. These are all common non-communicable diseases in refugees, تمام, or in refugee populations. Now, refugees refugees and displaced people, طيب, are particularly vulnerable to malnutrition, specifically undernutrition. ليه? Because of loss of jobs, طيب, so they don't have a stable source of income, they can't buy food, طيب, or they could, but not as much as they used to, يعني مثلا. Displaced from their homes and sheltering in areas with limited food access, يعني the areas that they're sheltering in have very limited food access, طيب. يعني مثلا if they're refugees in certain countries and those countries that they're the host nations, طيب, they don't give them enough food, طيب. Limited access to diversified food sources, and even if they do have food sources, they're probably eating the same thing every day or something. طيب. The food sources are not diversified, and this could lead to certain deficiencies in certain micronutrients and whatnot. طيب. طيب. How does this affect the refugees? Now, we talked about the malnutrition. How does this affect the refugees? طيب. Because of this malnutrition, the immune systems are going to be weak. Therefore, this is going to increase the susceptibility to other diseases. You're not eating enough, okay? So your immune system will be weak. So you'll be more susceptible to other diseases. تمام? Now, there's also delayed childhood development, okay? So the children, the refugees that are children, their development will be delayed. Obesity, some of you guys may be wondering, how are they going to suffer from obesity if they don't have enough food? Well, in some cases, they might have food. This is just that they don't have access to healthy food. So they eat a lot of unhealthy food, high calorie, calorie dense food. So they don't have the privilege of eating healthy food, and therefore they get obese. طيب. Children, pregnant women, and the elderly are often amongst the most vulnerable. Children, pregnant women, and the elderly are the most vulnerable refugees. تمام? Now, why are non-communicable diseases common in refugee populations? And why do people in refugee populations have a lot of non-infectious diseases? First of all, changing lifestyles. Sudden change in lifestyle could cause certain diseases. تمام? Behavioral risk factors like unhealthy diet, lack of exercise, tobacco use. A lot of refugees use tobacco as a coping mechanism. Okay, unhealthy diets because they don't have the privilege of eating healthy. Healthy food may not be available. Lack of exercise. Okay. Now, also, we have limited access to healthcare compared to the host population. The host population is basically the population of the people that were already in that country. طيب. When you're a refugee, you're coming to that country. تمام? If you're coming to that country, most of the time you're not going to be provided with the same healthcare as the host population. طيب. So diseases like diabetes and hypertension remain undiagnosed and they get worse. طيب. Why do refugee populations suffer from mental problems? Stress of adapting to the new environment. They feel pressure. They try to adapt to the new environment that they're in. طيب. Previous experience of war could lead to PTSD. Because of previous experiences, I mean, if they're a refugee of war, they could have PTSD. طيب. They're usually more suicidal and have greater incidences of psychosis. Okay, and the WHO estimated that 22% or 22.1% of conflict affected individuals or conflict affected populations طيب, suffer from mental disorders. Now, what are some maternal fetal health complications? We looked at maternal fetal health in the previous, I think it was the first lecture that we did. We looked at maternal fetal health, صح? Now, let's look at the maternal fetal health, or the mother's, let's look at the maternal fetal health طيب, of refugees. تمام? First of all, let's look at the maternal health. تمام? You have limited access to prenatal care. We said that prenatal care is the primary health care that needs to be provided to all women. That prenatal care is going to be limited. طيب? We have nutritional challenges like anemia, violence, infectious disorder, disease risks. يعني مثلا, she's not going to get prenatal care. طيب? At the same time, her nutrition is going to be lacking, okay, which is going to lead to anemia. طيب. Also, there could be violence, okay, against her, okay, because she's a refugee. طيب. So she's more prone to violence. Infectious disease risks. All of these can harm her and it can harm the fetus. Now, because of that, the fetus is subject to preterm birth, low birth weight, طيب, intrauterine growth restriction, which basically means that the fetus was not going to be able to grow properly in the uterus. طيب. Uh, we also have neonatal complications. يعني, even if they're born and they're healthy, I mean, in the first few days, there might be neonatal complications after that. Unhealthy infant feeding practices. تمام? يعني because of, again, the lack of food options, the infant feeding practices will be very unhealthy. Now, who are geriatrics, first of all? Geriatrics are old people. تمام? What are the non-communicable diseases uh, that happen in geriatrics and what are their effects? Two-thirds of older refugees described their health as being poor or very poor. تمام? Two-thirds. They suffer from things like heart disease, hypertension, diabetes, and they also find it difficult to afford medications. تمام? Now, diet issues with geriatrics. Basically, the diet of geriatrics or older refugees is inadequate. تمام? Just like the rest of the refugees, their diet is inadequate. طيب? And this affects them greater than, like, for example, this affects them at a greater level because they're old, right? They need good nutrition to survive. صح? Their meals were skipped. مثلا, a certain study reported they had skipped meals, decreased portion sizes, limited intake of fruits and vegetables, and this is done to يعني حتى within the refugee populations themselves. This is done to reserve more of the food, more of the already limited food, to the younger family members. تمام? Now, 61% of them reported that they felt anxious and significant portions of older refugees said that they felt depression and loneliness. And the reason for this is because they feel like they're a burden to their families. And خلاص, my family's suffering and I'm just like, they might be thinking, oh, I'm just old and my family's suffering and I'm a bigger burden on them. صح? Now, 74% of refugees indicated various degrees of dependency on humanitarian assistance. Yani they depend on humanitarian assistance. I don't think you need to memorize the percentages, but yeah, just get the general idea. Now, physical health or physical limitations of geriatrics. Geriatrics, generally older people, they have difficulty walking, they have visual loss, inability to leave their homes, and most of them require medical aid like walking canes or glasses. But what are some WHO interventions? Improving refugee and immigrant health, طيب, ensuring continuous quality essential healthcare, integrating migrant health into national and global policies, addressing social determinants and supporting SDGs. طيب, they can improve the refugee immigrant health, طيب, or they want to improve the refugee and immigrant health, ensuring continuous and essential healthcare to the refugees, طيب, integrating immigrant health into national and global policies. If it's integrated into national policies, then the countries or the host nations are most likely or more likely to integrate it, يعني, to implement it. طيب. And addressing social determinants, recognizing the social determinants that exist in refugee populations, and supporting SDGs. طيب. Now, what are the roles of medical students? The roles of medical students involve conducting research and collecting data. طيب. Conducting research and collecting data, advocating for policies that support refugee health. And if there are certain policies that support refugee health, we need to advocate for them. Giving mental health support to refugees by providing psychosocial care, طيب, like counseling the refugees, and collaborating with mental health specialists. تمام. So we can counsel the refugees, we can collaborate with mental health specialists, advocate for policies that support refugee health, conduct research on refugee health, طيب, preventing the control of the spread of infectious diseases by providing immunizations to these refugees. تمام. But there's a lot we can do. طيب. Now, let's solve some questions. Miss SN is a pregnant refugee with no other family. She is currently living in a refugee camp and she is not receiving sufficient medical care. What is she most likely to get upon staying in the camp? The correct answer is B, infectious diseases. We said إنه if a refugee stays in a camp for too long, surrounded by other refugees and the area is condensed, uh, there's a big risk of infectious diseases spreading. تمام. And yeah, طيب. Whenever you get a case of someone living in a refugee camp and they ask, what is the most likely disease in the camp specifically, it's infectious diseases. تمام. طيب. As atmospheric temperature rises, this is on the climate change lecture. As atmospheric temperature rises, which mosquito-borne disease becomes more prevalent? The answer is C, malaria, right? Malaria becomes more prevalent because we said that the um, Anopheles mosquito or the female Anopheles mosquito becomes what's it called? It becomes more active, right? Because it likes higher temperatures. It can survive better in higher temperatures. طيب. Now, those are the first two lectures that we were supposed to do at the beginning, but I decided to include them at the end because they're low yield, يعني in the final. And also because this first lecture is just a bunch of definitions that you guys need to know, so I decided to include it at the end. But yeah, let's get started. Introduction to public healthcare and primary health. To begin with, what is health? According to the WHO, the health is the is the state, sorry, of complete physical, mental, and social well-being, not merely the absence of disease. يعني a lot of people like to associate health with خلاص, يعني you don't have the disease, that means you're healthy. No, it's the state of complete physical, mental, and social well-being. Okay? Now, public health is all organized measures, طيب, whether public or private, to prevent the disease, promote health, and prolong life among the population as a whole. Okay? Now, you guys need to know these definitions. Okay? So, health is a WHO definition, public health is a CDC definition, and you need to know both of these definitions because they could be asked in an MCQ. Okay? Understand إنه health is not merely the absence of disease. That's a very big misconception. A lot of people like to think إنه خلاص, just because you don't have the disease, that means you're healthy. لا. You need to be completely يعني the physical, mental, and social well-being needs to be completely there. تمام. طيب. What is the health approach? The health or the public health approach? The public health approach goes all the way from diagnosing the problem to actually solving it. And this happens in four steps. First, we have surveillance. Surveillance is when we ask ourselves, what is the problem? Okay, where is it going wrong? And then risk factor identification. Risk factor identification is when we try to see, okay, we know the problem now. What is causing this problem? Okay, intervention evaluation. Intervention evaluation is when خلاص, we have the problem, طيب, we know what is causing it, طيب, now what can we do about it? That's intervention evaluation. And implementation is how will we do that? طيب. We figure out the problem first, okay? And then we look at what is causing it. And then what are we going to do about it? And then how do we do that? طيب. Implementation. Okay? And these are the four steps of public health approach. Now, these aren't the same as the three core functions of public health, okay? Don't get them confused. Public health approach and the core functions of public health are different, okay? Now, what are the core functions of public health? Assessment, policy development, and assurance. Assessment is basically collecting all of the data, right? Systematically collecting the data and analyzing it to make it available. طيب? And now, based on this data, we're going to develop certain policies, and this is called policy development. So first, you systematically collect the data, you collect all of the data, okay? And then, based on that data, you develop certain policies. طيب? Finally, we have assurance, which is assuring that the policies that you made based on the data that you collected gets to people in need. Okay. And if you want, you can read the actual definitions. Let's read them. Systematically collect and analyze and make available the information uh, uh, on healthy communities. Okay. طيب. Policy development is promoting the use of scientific knowledge or scientific knowledge base in policy and decision making. Assurance is ensuring the provision of the services to those in need. Okay, خلاص. For three steps. First, you collect the data, and then you make policies based on the data, and then you implement those policies. Simple as that. Now, these core functions of public health are divided into the 10 essential public health services. طيب. We have monitoring health and diagnosis and investigation, which falls under assessment. We have to inform, educate, and empower, mobilizing community partnerships, طيب, and developing policies, which all fall under policy development. And then we have the last four, which is enforcing laws, linking and providing to care, assuring a competent workforce, evaluation and research, which all fall under assurance. Tamam? I would recommend memorizing these 10 if you can, because you could be asked about it as an SAQ. Tamam? Just memorize these 10, okay? And memorize what they fall under as well. Yani these two for assessment, these three for policy development, and so on. Now, what are the five public health operations? First, surveillance. يعني we try to collect the data and see what's going on, what's wrong. طيب. And then disease prevention, and we try to prevent the disease from occurring. And then health protection, we try to protect the health of the individuals. طيب. Health promotion, we try to promote a healthier lifestyle. طيب. And then monitoring preparedness for response. In case a disease happens, we need to monitor preparedness for response and we need to be ready to respond. Now, what are the public health or who are the public health stakeholders? Public health stakeholders are basically groups that have influence over public health. طيب. And these could be the media, because the media could push health. يعني they could push health promotion campaigns and they could change the public's opinion on a certain matter. They're considered public health stakeholders. طيب. Employers and businesses, okay, like health, which can perform مثلا health insurance programs, wellness initiatives and benefits to their employees. طيب. Government agencies, which like city planning, for example. طيب. And health and all policies. مثلا if health and all policies, what that means is, remember like the COVID-19, what's it called? Social distancing. That was an example of a government agency pushing a certain public health initiative. صح؟ فyeah, academia, okay? But basically anything or any organization that has control over public health is called a public health stakeholder. Okay, and these are the four. Now, what can these public health stakeholders do to improve health or public health programs? First, water safety. طيب, the water needs to be clean. Okay. Road safety. The roads need to be safe to drive on. Okay. Tobacco control. طيب. There needs to be a control on tobacco. There needs to be a control on smoking. Immunizations. طيب. People should be provided with immunizations. The immunizations should be kept up to date to reduce the spread of diseases. Workplace safety and promoting healthy eating. Basically anything that could improve public health, that could improve general health. I'm sure you can think of more, but these are the examples that I have over here, okay? Now, there are certain differences between public and primary care. What are they? We mentioned them previously, earlier in this PAL session, but yeah. Primary healthcare focuses on individuals, not the whole population. Public healthcare focuses on the whole population. Primary healthcare emphasizes on diagnosis and treatment, and public healthcare emphasizes on disease prevention. Now, what are some primary healthcare services? We said in primary healthcare is provided to individuals. تمام? What are some healthcares that can be provided to individuals? We have maternal and fetal healthcare, mental health support, chronic disease management, and preventive screening. طيب? Now, let's get into the next lecture, universal healthcare. طيب. What is universal healthcare? Universal healthcare, or UHC, is providing healthcare for everyone without hardship or financial distress. So every single member of the population should be provided with healthcare, طيب? And they shouldn't go bankrupt because of that healthcare. تمام? Now, the healthcare needs to be of appropriate cost, as we just discussed, but it also needs to be of appropriate quality. يعني مثلا, if the doctors are untrained, then the quality is not appropriate. طيب? The quality needs to be appropriate and the cost needs to be appropriate. Finally, universal healthcare does not mean free healthcare. Okay? يعني just because the healthcare is affordable doesn't mean that it's free. A lot of people like to associate universal healthcare with خلاص. Universal healthcare is free healthcare. No. Universal healthcare means affordable healthcare, but it doesn't mean free healthcare. Okay? Now, what is needed to achieve universal healthcare? The services need to be affordable, as we just said. طيب? The facilities need to be reachable, and you need to actually be able to get to the hospital. People must have knowledge of these health services, and the whole point of this is يعني, of me mentioning these three is that having hospitals alone is not enough. And if you have like a lot of hospitals alone, that's not enough. تمام? The services need to be affordable, the facilities need to be reachable, people must have knowledge. As we said previously, the quality of healthcare needs to be on par, it needs to be high, right? طيب. Now let's look at some real life examples. طيب. In Japan, universal healthcare was implemented. And what happened is that they gave the citizens healthcare regardless of income and regardless of income. تمام. They gave them all healthcare. طيب. Regardless of their income and their employment. And what this caused is that the life expectancy in Japan increased to 73 years. For context, the life expectancy in the US is 70 years. It increased even further than the life expectancy in the US. طيب. Why? Because it allowed people to find a healthcare provider and to get preventative and early medical treatment. Okay? And this caused an increase in the life expectancy. طيب. Now, WHO and leprosy control. Leprosy is a skin disease. And 20 years ago, the skin disease was, there was an outbreak of the skin disease. تمام. What the WHO did is that they provided early diagnosis, طيب, health education and free medication to everyone who suffers from leprosy. طيب. And this led to 14 million people being cured from the disease. 14 million. طيب. Now, malaria control. Countries that have increased the use of mosquito bed nets while increasing the availability of effective medicines has 50% less malaria deaths. This is mosquito bed net right here. طيب. And yeah, these just go to show إنه these simple things, يعني these simple things can go a long way. تمام. And these are the three examples of universal healthcare that you guys need to know. طيب, checkpoint. Let's answer this question. Pause and answer. طيب, Saudi Arabia aims to open a program to fund campaigns to help spread awareness of COVID-19. What is the best description of this? The correct answer is B. Public health initiative. And the reason why, or the reason why, is because it is done by a government. طيب, it is done by a government. And the whole point is to a government which is a public health stakeholder, and the whole point is to improve the health of the population. طيب, so that's a public health initiative. Okay. When is universal healthcare achieved? The correct answer is B. When all of the population has access to healthcare. طيب, it's not when all hospitals are free. We said it doesn't mean free healthcare. It's not when doctors are available, because doctors could be available, but the healthcare could be expensive. It's not when insurance exists. تمام? It's when all of the population has access to healthcare. Affordable access. طيب? Now, final lecture, determinants of health. طيب. What are the determinants of health? In order for me to explain the determinants of health, we're going to need to take the example of this guy right here, okay? Now, imagine this guy right here, okay? Anything that affects his health that is non-medical is called a social determinants of health. Anything that affects an individual's health that is non-medical is called a social determinants of health. And by the way, you need to know it acts on the individual. طيب? The risk factor is on the individual. طيب? Because this was asked about before. تمام? Now, there are three definitions that you guys need to know, according to three different organizations, the CDC, WHO, and ODPHP. If I was to only memorize one of them, I'd memorize the WHO definition, but you still need to know the rest, طيب, in case you get asked about them. CDC defines them as the factors that contribute to a person's current state of health, and these could be biological, socioeconomic, physiological, and behavioral. طيب. The WHO defines them as the condition in which people can grow, or in which people grow, live, work, and age. And the ODPHP defines them as the range of personal, social, economic, and environmental factors that influence health status. طيب. Now, these three definitions, طيب, are all in agreement with this right here, in which non-medical factors that affect the healthcare of a person. طيب. Now, what are some examples of the social determinants of health? First, we have economic factors like wealth, income, employment. طيب. يعني if someone's not employed, they don't have a stable source of income, طيب, then their health is probably going to be worse. ليه? Because they can't afford proper healthcare. طيب. Lifestyle related factors like diet and physical activity. Their diet could مثلا consist of foods that are very unhealthy. Their physical activity could be very low. طيب. Physical environment like air and water quality. Okay, the air quality might be very bad. I remember we had a question إنه a person was living next to a refinery, طيب, which constantly produced toxic gases. Or what is the social determinant of health in this case? And the answer was environmental. صح? There's an environmental barrier. صح? يعني physical environment is messed up. The air quality is going to be messed up. تمام? The air quality is messed up, therefore it's an environmental factor. Okay. Now, water, طيب, as well. If someone doesn't have access to clean drinking water, that can affect their health. Social environment, like education and community safety. How safe is the community that they live in? Are they well educated or not? طيب. Access to quality healthcare, like distance to services. If you have a medical emergency and you live 3 hours next to the closest hospital, then you're probably not going to make it in time. تمام? Now, all of these five factors are social determinants of health. And if you look at them, they're all non-medical factors that affects a person's health. Okay? Now, let's take some cases. According to what we just discussed, تمام? A 42-year-old man, upon examination in a hospital, was found to have chronic hypertension. When he was asked if he was consistent with his medications, he replied, stating that he wasn't given the instructions or guidance about his medications. What factor plays a major role in this situation? The correct answer is B, educational. صح? Because خلاص, simply he wasn't given guidance. طيب. The barrier is education. Now, a 56-year-old man has skipped multiple checkups due to the rising costs of medical services. Which of the following plays the most significant role? صراحة, all of you should be getting this right. The answer is C, financial. خلاص, he doesn't have money, okay? He can't afford the medical services. The barrier is financial, okay? Now, this picture, I put it here to explain the difference between three concepts to you guys, or two concepts, معلش. Equity and equality. طيب. In the picture on the left, we gave all of them one box. تمام? يعني we had three boxes and we gave everyone one box. That is an equal distribution of resources. However, this little kid right here, he still can't watch the game. طيب. It's still unfair. Even though the distribution of resources is equal, it's unfair to this kid right here. أو مش it's unfair, but it's not equal. Okay. Now, here on the picture on the right, the distribution of resources is not equal. صح? يعني we gave this guy right here two boxes, we gave this guy one box, and we gave this guy no boxes. The distribution of resources is not equal at all. However, they can still watch the game. صح? They can all watch the game. This is called equity, which is when they're all equal. تمام? Regardless of the distribution of resources. This is called equality, giving everyone the same resources across the board, no matter what. تمام? These definitions reflect what we just discussed. Equality is providing everyone with the same resources, support, and/or opportunities across the board. True equality means that there would be no difference in treatment despite race, gender, or income. طيب? Equity is the absence of avoidable or remediable differences between groups of people. فهنا there's no differences between them. تمام? Defined socially, whether those groups are defined socially, economically, demographically, or geographically. تمام? Now, inequality is basically failure to avoid or overcome inequalities. طيب صراحة يعني I don't know how you use the same word in the definition of the word, but اسمع علينا. Inequality is basically the opposite of equality. Just know it as that, okay? Now, one more thing you guys need to know is for inequality is that inequality is unfair. طيب يعني any unfair medical practices are called inequality. طيب and additionally, they're avoidable. يعني you could avoid inequality. طيب بس we just don't. But you could avoid it. A student was reading an article that mentioned health inequality and inequity. Which one of the following is the most accurate definition for inequity? The correct answer, is C. They are health practices that are unfair and avoidable. تمام? يعني you can avoid them and they're unfair. Okay? This was a past question. Thank you guys so much for watching. Again, if you have any questions, you can always email me or you can send me a message on WhatsApp and I'll be more than happy to answer. Please scan this QR code if you have time. And thank you very much.